What happens to your prostate when you masturbate daily after 50? Have you ever wondered if at this age maintaining a regular masturbation habit is okay or not? If you're a man over 60, this might be one of those questions you quietly ponder, but never dare ask your doctor whether that habit is harming or helping your health, especially the prostate. The answer might surprise you. Don't forget to subscribe to the channel, and turn on notifications so you don't miss other topics on men's health shared straightforwardly and scientifically. The prostate, the silent hero of men. The prostate is a small gland located right below the bladder, but plays a big role in producing seminal fluid which protects and nourishes sperm. When young, almost no one pays attention to it. But after 50, especially past 60, this gland tends to enlarge, causing frequent nighttime urination, weak stream, or even affecting sex life. Many older gentlemen share that I take care of it myself every day, feel healthier, sleep easier, but also worry if it's harmful. So what's the reality? Is masturbation after 60 good or bad? Contrary to online rumors like causing fatigue, testosterone decline, or even increasing cancer risk, studies show a completely different truth. In 2016, Harvard University followed over 31,000 men for nearly 20 years. The results showed that those who ejaculated at least 21 times per month had a 33% lower risk of prostate cancer compared to those who did 4 to 7 times. Why, there's a hypothesis called prostate stagnation. The gland produces fluid daily, and if not regularly released, the fluid accumulates easily, building up toxins, dead cells, bacteria. Meanwhile, regular ejaculation helps clean the system and reduce inflammation, thus helping the prostate function better. Do you find this information useful? Don't forget to like and leave a comment. But don't misunderstand, more isn't always better. There's a boundary between regular and excessive. Masturbating daily isn't wrong, but ask yourself after doing it, do you feel energized or exhausted? Are you doing it to relax or because of emptiness? Do you need stronger stimulation than before? Does it still bring sensation or just a mindless habit? When the action becomes an uncontrolled habit, it can have reverse effects. Some experience lower abdominal pain, heaviness from continuous stimulation without rest. Improper posture during masturbation, especially sitting long or hunching, can also cause nerve compression in the pelvic area, leading to prolonged numbness or pain. A gentleman over 60 once shared, "I thought I was healthy doing it every day for fun, but after a few months, I started feeling back pain, lower area fatigue, frequent nighttime urination. Turns out I wasn't letting my body rest properly." 5 warning signs that your prostate is speaking up. If you experience the following symptoms, don't take them lightly. Frequent nighttime urination more than 2 times per night. Weak, interrupted stream, feeling like you haven't emptied, pain or discomfort during ejaculation, fatigue, reduced desire, or erectile dysfunction. These signs don't mean cancer, but they're signals to check early. The earlier detected, the simpler the treatment. If you've experienced one of these symptoms, share in the comments. Your story might help others recognize the issue sooner. Secrets to keeping your prostate healthy overall. Whether you masturbate regularly or not, you still need comprehensive care. Healthy eating. Tomatoes, watermelons, pink grapefruits contain lycopene to reduce cancer risk. Broccoli, spinach support hormone detox. Salmon walnuts, rich in omega-3, reduce inflammation. Pumpkin seeds rich in zinc, good for testosterone. Limit processed meats, sweets, fatty milk, as they easily cause inflammation and hormone disruption. Regular exercise, just brisk walking 30 minutes a day, can help reduce disease risk. Exercise also helps control weight, improve blood circulation, and increase testosterone. Effective stress management, prolonged stress, increases cortisol, one of the culprits causing prostate inflammation. Besides ejaculation for relief, you can try light meditation, listening to music, walking, or chatting with friends. Regular health checkups and PSA testing, especially important for those over 50 or with family history. Don't wait for symptoms to see a doctor. So, is daily masturbation after 60 advisable? The answer is, if you feel energized, sleep well, mentally stable, it's completely normal and even beneficial for the prostate. But if you feel tired, out of control, or have abnormal signs, listen to your body and adjust. The prostate can't stay healthy just by releasing the valve. It needs a reasonable diet, active lifestyle, and good mental management. Dear uncles and gentlemen, I want to ask honestly lately, have you been frequently waking up at night to urinate? Some nights once, some nights 3 or 4 times, not to mention having to hold it until morning. If so, this isn't just a sleep issue, but could be a gentle but very clear warning from your body, specifically from the prostate. And notably, this condition is not rare. From my observation and years of experience, over half of gentlemen over 60 experience this. I once treated an older gentleman from the Midwest. He said every night, I'm like on bathroom duty, sleep less than 2 hours, then have to get up. Body tired, mind foggy, but morning still have to tend the fields. Honestly, I understand and empathize deeply. And that's why, in this video, I want to share with you 3 simple but surprisingly effective habits. No expensive drugs, no complex procedures yet, can help you significantly reduce nighttime urination, sleep deeper, and better help the prostate function stably, and most importantly, regain the strength and quality of life of a man in his 60s or 70s full of vigor. If you find this topic important, I invite you to like the video, subscribe to the channel, and turn on notifications so you don't miss future useful shares on men's health. Second, why does the prostate cause frequent nighttime urination? To understand why you have frequent nighttime urination, we need to understand a bit about the main culprit, the prostate. The prostate is a small gland in the male body located right below the bladder and surrounding the urethra. Simply imagine it's like a ring hugging the water pipe. That's the urethra from the bladder out. The problem starts when this gland enlarges with age, and when it grows, it squeezes the urine tube, causing a series of symptoms many are experiencing, like difficulty starting urination, waiting long to start, weak urine stream, not as strong as before, feeling just finished, but need to go again, especially waking up multiple times at night. I once had a patient from Arizona. He said back in the day, urination like a fountain now, like dripping water, and after finishing still feel unfinished. This is a very realistic description, very accurate for prostate enlargement symptoms. The important thing to remember is the prostate enlarging is natural, like gray hair or joint aches. But that doesn't mean we have to endure it. I say this because many think old age, who doesn't? And so they live with that inconvenience for years, leading to health and mental consequences. The good news is science has proven natural, simple, effective measures to reduce symptoms, even reverse some enlargement, without drug abuse. And right now I'll share each habit in detail. 3 habits. Number 1, drink water correctly at the right time. Surely you've heard the advice to drink enough water daily for health. But one more important thing few mention is when to drink is the key to improving nighttime urination. I call this smart water drinking habit. Why is timing important? When the body isn't supplied enough water during the day, urine becomes concentrated, containing many wastes and toxins. These substances passing through the bladder and prostate will cause irritation, increasing the urge to urinate, especially at night when the body needs rest. And anyone who's experienced waking up midnight, groping to the bathroom, knows the tired, irritable feeling next morning, not only affecting sleep, but also reducing overall health, memory, and spirit. So, how to drink water correctly? Very simple. I only advise you to remember 3 golden time slots. From 6:00 to 12:00 noon, this is the time to drink the most water. After waking, the body needs to replenish water lost during sleep. Drinking a glass of warm water in the morning also helps clean the digestive system, enhance circulation, and wake the body. From 12:00 to 18:00 afternoon, continue maintaining sufficient water. Every 1 to 2 hours, sip a small glass. Divide water evenly. Don't wait until very thirsty to drink. After 18:00 evening, reduce water to minimum. If thirsty, only drink small sips to soothe the throat is enough. Avoid drinking too much water after dinner, especially 1 to 2 hours before bed. Some have the habit of drinking strong tea or lots of soup in the evening. These habits seem harmless, but in reality make the bladder work continuously all night. I once advised a gentleman from Arizona. He said every evening I drink 3 cups of green tea, thinking liver cool kidney supplement, but don't understand why every 2 hours have to go to the bathroom. After adjusting the tea drinking habit to daytime, the nighttime urination reduced clearly in just 1 week. What does science say about this habit? A study published in the U.S. Urology Health Journal showed that men adjusting water drinking timing as above reduced up to 40% of nighttime urination times. 40% is not a small number, especially for those waking 3 to 4 times per night. Reducing to 1-2 times or even none is the dream of many. And the wonderful thing is, you can start today. No need to buy drugs, no tools, just adjust a bit in daily habits. If you find this a useful tip, don't forget to like this video and share for friends, loved ones to know. I ask honestly, how do you have the water drinking habit in the evening? Are you making the mistake of drinking lots of water after 7:00 p.m.? Please leave a comment below. I really want to know and will respond to each if possible. Habit number 2, strategic walking after meals. The second habit I want to share with you sounds too simple to believe. But in fact, its effectiveness has been proven by many serious scientific studies. I call it strategic walking, meaning walking with calculation after meals. Sounds too simple, right? I know many hearing this will wonder. Walking also helps the prostate healthier. In fact, if you notice, older people in rural areas are often healthier and less sick, not only because of healthy eating, but also because they always move after meals, like going to the yard, sweeping watering plants, feeding chickens. All these are a form of light, walking after meals, and this seemingly small action brings great benefits, especially for the prostate. Why is walking after eating effective? After each meal, our blood sugar level rises. If the body doesn't move, that sugar will stagnate and over time lead to many health problems like diabetes, blood fat, cardiovascular, and chronic inflammation. which is the silent culprit making prostate enlargement faster. When you walk after eating just 10 to 15 minutes, the muscles in the body will use the just-eaten sugar for energy. Thus, blood sugar is stabilized, avoiding the peak-valley fluctuations that cause inflammation and metabolic disorders. Chronic inflammation, I emphasize, is one of the top causes. Prostate enlargement, increasing pressure on the bladder nighttime, urination, weak stream, and urinary issues by scientific evidence. A large study published in the Diabetes Journal compared two groups. One group walked 45 minutes daily at any time. One group divided walking time 15 minutes right after main meals. The results were astonishing. The post-meal walking group controlled blood sugar much better, reduced inflammation, and stable blood pressure. All are factors closely related to prostate health. This means just 15 minutes strolling around the yard after lunch or dinner, you help the prostate reduce pressure, improve function, and support heart digestion and sleep. Practical advice. I know many have knee pain, joint degeneration, so long walking can be difficult. But no problem, we don't need to walk fast or much, just walk slowly, steadily. Not sitting still after eating is already good. For example, a gentleman from Arizona I advised after dinner, he often sat watching TV immediately. But after applying 10-minute walk around the house, he told me he feels less bloated, sleeps better, and less nighttime urination clearly. That's the beauty of this habit, is effectiveness from consistency, not intensity. Do you have the habit of walking after meals? If not, can you start today? Please leave a comment below. Share with me and the community. Who knows, your experience might help others. And if you find this content easy to understand close, please help. Like the video, share for friends, same age, and remember to subscribe to follow future videos on men's health. Habit number 3, natural prostate cleaning, scientific and effective. The third habit I'm about to share might make some feel a bit delicate when hearing, but I permit myself to speak sincerely, seriously, and with utmost respect. This is a completely normal medical issue, nothing to be embarrassed about. I call this natural prostate cleaning habit. Scientific basis from Harvard. A large-scale study from Harvard University, seen as the hub of world medicine, followed over 30,000 men for nearly 20 years. The goal is to find the relationship between ejaculation frequency and prostate health. The results were surprising. Those with ejaculation frequency about 21 times per month or more have a 33% lower risk of prostate cancer compared to those with less ejaculation. In other words, regular sexual activity or reasonable self-relief, if maintained at a healthy level, is not only natural physiological need, but also an effective way to prevent disease. Why is this good for the prostate? The prostate is where a large part of seminal fluid is produced. Over time, if not regularly released, this fluid can accumulate like a glass left long without pouring, will have residue buildup. Those residues can cause inflammation, irritation, increasing risk of enlargement or tissue damage. Regular ejaculation helps flush out those residues, reduce internal pressure, reduce infection risk, and over time, help the prostate function more stably. For older people, is it suitable? I know many older gentlemen think I'm old. Poor health, that thing is over. But I affirm this isn't just for young people. Even if no longer regular sex with partner, you can still maintain natural body activity in a healthy, private way. Nothing wrong. The important thing is to understand correctly and see it as part of healthcare, not shameful. I once met a gentleman from California over 68, living alone after his wife passed. At first, he was quite hesitant talking about this topic. But after detailed counseling, he understood it's physiological, not moral or emotional, and started caring for prostate health this way. After a few months, he came back and said, "I sleep better, less tense, feeling in lower abdomen, and feel much healthier." What to note? Of course, I don't encourage abuse or deviant behavior. The core is frequency suitable for your health and feeling not affecting psychology or daily life. Always keep positive mindset. See this as a way to care for the body. This doesn't replace regular checkups, but can support reducing inflammation, clearing the prostate, and improving urinary function naturally. I know this sharing part is a bit delicate, but if you have thoughts needing more detailed ask, don't hesitate to leave a comment. Write subtly, politely, I'll answer. Within professional ability, absolutely no judgment. And if you find this part useful, you can share the video discreetly for friends, brothers, loved ones, same age. Who knows, timely information, this might help someone avoid unwanted disease. Summary: prostate health is quality of life. Dear uncles and gentlemen, we've just gone through 3 seemingly simple habits, but with great power in improving prostate health, thereby improving sleep spirit and manly strength. The first habit, smart water drinking, isn't drinking a lot, but drinking right time. Enough water. Daytime, little water. Nighttime sounds easy, but this change can help you reduce nearly half the times waking to urinate each night. The second habit, strategic walking after meals, just 10 to 15 minutes. Light stroll also helps stabilize blood sugar, reduce chronic inflammation, and indirectly help the prostate breathe easier. And the third habit, natural prostate cleaning, though a bit delicate, but science-proven beneficial for men's health, especially at high age. These 3 habits don't require drugs, no cost, no side effects, but if maintained regularly, will bring clear results in just a few weeks. Important reminder, can't replace regular medical checkups. I also permit emphasizing one important thing. Even if you apply the 3 habits well, still can't skip regular health checkups, especially after 60. Specifically, every year should check prostate, including PSA test, prostate-specific antigen quantification digital rectal exam, if doctor indicates ultrasound, or more in-depth if abnormal signs. Because early detection is still the supreme weapon in preventing prostate cancer and effectively treating related diseases. I've witnessed not a few cases patients come too late, making treatment more difficult, while just checking once a year can live healthy peace. Real story. A gentleman named Mr. Terry, 64 years old, living in New Jersey. He came to me with frequent urination to 5 to 6 times, night tired, can't sleep, spirit down. After examination, he no cancer, just benign prostate enlargement. I guided him to apply exactly these 3 habits and re-exam after 6 weeks. Result, he only nighttime urination. Once, sleep, well, eat better. He said, "I feel like young again a few years just because sleep straight to morning." That's why I believe in the effectiveness of these seemingly small things, but when done right, can change entire quality of life. Now, I really want to hear from you. Among the 3 habits, which one surprises you most? Have you tried applying any habit yet? What result? Please leave a comment below. Share your story or question. I'll try to respond all comments possible because each experience is valuable. If find video useful, don't hesitate to hit like button. If you think a friend, loved one, brother, son can benefit from this information, please share this video for them. Who knows? Your sharing might help them detect disease early or improve life. And if not subscribed, hit subscribe button now, then turn on notifications to not miss future videos on men's health, including how to choose good foods for prostate, simple home exercises, and many other interesting knowledge. To continue the prostate care journey, invite you to click the video appearing on the screen. In it, I'll share details on the best foods to reduce inflammation and support healthy prostate according to taste and living conditions of us Vietnamese. Goodbye, and see you in the next video. Because health is the most precious asset, and the strongest man is the one who knows to care for himself.